I think I got interested in medicine basically because I've always been interested in biology and anatomy, and my dad was a physician, and so I grew up around that, and I got to see how he worked, and I really got to see kind of the rewards that he got out of his job, and I think that's really a big reason that drove me towards it, to be honest. I think that, we all want a rewarding career and we all want to help people. I think that helping people is one of the most rewarding experiences we can have, and medicine is just one of those fields that does that, but for me it just seemed to really fit and kind of do everything that I wanted to do in terms of my interests and help people. My name is Tom DeVries, and I am a sports medicine and non-operative orthopedic physician. I've been a physician for 6 years now, and I work at our orthopedic clinic. I grew up in Wisconsin, and my parents are both Canadian, and so obviously I grew up playing hockey, and so I've always been a sports guy. I've always loved hockey, and so I've always been interested in sports, and so that was kind of a no-brainer for me. My first interaction with the sports medicine doctor was actually when I broke my arm playing hockey. My bone came out of my arm and I actually touched it. It wasn't fun at the time, but I do think that played a role in kind of driving my interest in that direction. I think my role as a sports medicine physician can sometimes be a little bit confusing in terms of what do I actually do, but I am a sports medicine doctor and a non-operative orthopedic doctor, and so I don't perform surgery, but I see a wide variety of injuries and conditions related to bone, muscle, joints, tendons, nerves, and I treat those and manage them in a non-operative way. If my patients, and they often do, need to be referred to a surgeon because their problem can't be managed non-operatively, well, I've got tons of excellent surgical colleagues that I can easily send them to in a timely fashion, and it works seamlessly. My general philosophy towards medicine is that exercise and motion are some of the most important aspects of our health. It was actually the father of modern medicine himself, Hippocrates, who said that walking is man's best medicine. And I think that it's been 2,500 years since then, and not much has really changed. So that's really kind of what underpins a lot of how I approach my patients and what my goals are as a physician. And that's what's important to me, and that's why I like going to work every day and seeing the patients that I see and helping them stay active and healthy.